Okay, everybody, I want to introduce my dear friend, Julie Petyak-Ryan, who is an acupuncturist and Chinese medicine doctor who has been practicing here in Camarillo at least as long as I've lived here, because I think you're one of the first people I met when I moved to town.
Yeah, since 2002.
Yeah, so she's been here a long time. She has a new office in a beautiful place up in Camarillo, off sort of kind of near Flynn Road, and
Institution Ale.
the Institution Ale, yeah, near Institution Ale. And Julie is going to tell you a little bit about her background and everything, so I won't go into all that stuff. Just to say she's an excellent Chinese medicine doctor. I've been her patient now for, I think, again, since I moved here, about, what's it been, 18 years, something? It's crazy, crazy amount of time. And she is taking time out of her busy schedule to come and talk to you guys. So I want to say every once in a while, Julie will take one of our students as an intern.
Yes.
And if you're interested in Chinese medicine, if you get turned on by stuff that she's talking about, think about that. And I think now we've had 3 or 4 students who are interns that go off and then now at least become or are in the process of becoming Chinese medical doctors.
Yes.
So we've seen a
Carissa is graduating.
Carissa's graduating.
So my first one.
Yeah. So we're really happy. She may come back, actually.
I'm hoping.
Very cool. Yeah. So really want to welcome Julie. Thank you so much for coming.
Well, happy last day of school. Last lecture. No pressure on me. We'll be quick about it. No. I love doing this lecture. I guess I've been doing it probably 12 years, at least. So I'm happy to be here on your last day. You guys all have finals next week, so I'm going to give you hopefully some ideas on how to be less stressed out, a little more self-care, that kind of thing. My main goal today is to get you guys educated so you can walk out of here and say, okay, I know what acupuncture is, I know what it involves, I have seen it. We're going to have a demonstration here of both the needles and the cups, which is awesome, and the traditional cupping, and understand how it works and what it's good for and why, right? So any of you have experience with acupuncture and can already answer those questions right now? I actually have someone here I know, so I can't, well, yeah, so that's really good. So I'm happy because all of you, I get to educate you, and you get to learn a little bit of something that you didn't know before, and you should know about it because it's a really incredible way to augment your healthcare. And you don't even have to go to an acupuncturist, it's just the understanding of how your body's working and maybe why and what's going on and things we can do a little differently is huge. So I want to offer that for you today. So how that's going to go today, I think I'm going to go about an hour, right? I need to be out of here at 11:30, if that's okay. I'm going to start by just kind of giving you a little background on me, a little background on acupuncture. I think I'll start with acupuncture as a career, as a profession, what it involves, what we learn, and then I'm going to go into a little bit of the basics of Chinese medicine, just so you can understand the theories. I know Dr. Volkin has given you some background on the 5 elements. I believe you guys have been exposed to that, and any tied with the emotions, like.
Not really.
Not quite, no. Yeah. Which I figured is this a psych class, right? Right. So we're going to kind of tie in the emotions with Chinese medicine and how that works, a different way to kind of explain what's going on in your body when you're feeling something. And then I want to do a demonstration of acupuncture on the back, just some nice shoe points, so you all know how lovely it is and it's not painful. And then we'll do the cupping as I'm lecturing and maybe explaining that. And then after that, I will have time for questions and all of that. And that should sum up the hour. Does that sound good? Okay. Good. So I will start by just introducing you to who I am and kind of why I got into what I'm doing. So if you can, choosing, if you're already in your career, choosing a career that you actually love is ideal, right? Because it's kind of no fail. You can't not succeed at that because it's something you're so invested in, right? So I was lucky enough, in a strange way, to come across this field. I was in an accident when I was living in Hawaii. I was in a scooter accident. I was 25 years old, and I was not wearing a helmet. I don't even think I had shoes on. And I'm driving down the street, driving home from the beach, and I was living there at the time. And a truck hits me, and anyway, it ends me up in the hospital for about 3 weeks, and I had major reconstructive surgery on my head, head damage, like head trauma. And they put about 20 plates of titanium, redid me, and it was brilliant. They like remade me, so I'm kind of bionically done up top here. So I'm very thankful for Western medicine and the brilliance of trauma care. Let's just put it that way. And then once I've healed, they send you out of the hospital and I'm not feeling good, but I'm here, right? And so here's the gap, right? Western medicine, by the way, in our opinion, and on the complementary side, it is all together we have to work together. So they're really, I want to get rid of any possible idea that, any complementary alternative medicine is against Western medicine. Today, in this society right now, it is so important we're all working together, and it's actually starting to happen. And I'll go more into that a little bit. But anyway, so I got my life saved from it, and then I was kind of a mess. And so I sought out my first acupuncturist as a result, got my first treatment. The brilliant doctor happened to be 90% blind, so you kind of understand when you're getting a treatment, how could you actually do that without being able to see, but you can. The guy was amazing. So I was so taken by my first treatment that I started to look into having that as something I wanted to do for my career. At the time I was teaching different things. Well, everything it was good, but it wasn't, right? So anyway, that was it. And so I ended up choosing where I wanted to go. So I ended up going to San Diego. There's a college called Pacific College of Oriental Medicine, and they have 3 campuses, one in New York, one in Chicago, and one in San Diego. And the benefit of that is you can do some internships at other places in different cities. And so anyway, I studied in San Diego, had a great education, graduated in 2000, and then moved to Camarillo after a little stint in New York City treating there, and have been treating here ever since. And I just absolutely love what I do. So, and Camarillo back then didn't really have a lot of us. There was a handful of acupuncturists. There still is. If you look, it's probably 12 of us or 8, 10 in Camarillo. So it's kind of neat. We all know each other, and it's just a nice community. But I love kind of pioneering this medicine here because not a lot of people really know how it works or what it's about, that it's even an option, and that it doesn't hurt, right? And it's so effective. So especially with pain and all kinds of things. So that's my background. I'm super thankful to be here. And I treat all kinds of things. I'm going to just show you. I do a lot of work with fertility, which sounds really weird. Like, how does that even work? How do I get women pregnant? But when women can't get pregnant, there's an imbalance going on, either with the woman, with the partner, both, what's happening. And we really, acupuncture and Chinese herbal medicine really excels at endocrinology and balancing hormones, right? And so that's a big thing of what I do. This is a great explanation of how it kind of works. That's kind of why I brought it up here. And it does. It restores equilibrium. You become physically and emotionally balanced, especially from when you walk in and get your treatment. And then when you leave, people are a whole different energy. It's kind of like you feel like dopamine is actually released. So I'll just go a little bit into how it works so you know what's going on when you get a treatment. But acupuncture, cupping, wide variety of conditions. I do a lot of pain management. So my number one thing, like I have a handful of patients this afternoon, and 5 of them are pain management people, chronic pain. There's a neuropathy patient and 2 fertility patients. So we do all kinds of different stuff. Gynecological stress, and we'll talk about that underneath it all, is so important, and it is one of the, if it's not the cause of a disease, it's definitely not helping whatever's wrong with you, right? And so it has to be addressed, and that is another thing that acupuncture actually excels at. It's why acupuncture works so well with so many disorders, is because it mitigates the stress response, okay? It's brilliant. So that's basically a nice description of how it works, what it does. So 2 things. Now I want to explain to you, and you're going to have to repeat this in the test, right? Just kidding. First thing is, how does it work, right? So what goes on, how am I putting a needle in something and making something happen, right? So the 2 ways I want to describe, one is with the physical nervous system itself, like we're going to have a patient here, and we're going to have him face, and I'm going to treat his back. And a lot of people come in and they have back pain. And so I'm going to actually, my style is to put needles into the area of pain locally and try to get a response from the muscle tissue to release, right? So it's kind of like this. You're chopping vegetables and you cut your finger, right? Whoops, you have a tissue damage, okay? You have it bleeding. Something has actually damaged the tissue. Your body will send a signal to your brain and say there's a problem and you need to send some blood flow in there and go clean it up. So your brain sends inflammatory agents to the site where you've been cut or where a needle has been placed, right? And it inflames the place and allows blood flow to go to that area and swell it. And in the blood is what that area needs to heal, right? It has phagocytes, it has white blood cells to clean up any bacteria, it's got all the things that injury needs to heal. And then the last thing it does is it sends an anti-inflammatory to resolve the location and the incident. Okay, and it happens in like 10 seconds, right? Unless it's a major cut, and that's going to take a little longer. But that's what goes on in an instant response when you get cut or tissue has been damaged, right? You poke, even a paper cut, right? Same event. Now imagine if you've got a tight neck and you have poor circulation there, or your low back is really sore, or your hip has been injured and you haven't been able to move it in 3 weeks, and you've got all these issues where there's not a lot of circulation happening because you're tight, and you're doing this all the time and studying. When I put needles in the neck, in the upper back, in the shoulders, I get your body to respond in exactly that way, and boom, you've got all kinds of blood flow, things change, it's like, whoa, what's happening? And then I retain, which is keep the needle in for about 10 to 15 minutes in the area, so your body now does another thing. Now this is part 2, and this benefits everyone. So while I'm in there and I'm relaxing the physical tension or the stress or the pain, right? Or getting a muscle to contract, we do that with hips and things like that. You can actually feel the muscle contract. This is just my style. Not everybody needles like this, but it's super effective. So while that's happening, something else is happening in your brain, and that is, as soon as the needle goes in, the brain says, okay, go to that area, but it also says, okay, we need to start, there's a stress response happening. I'm creating little stressors, right? I'm kind of irritating your body, so your brain's like, what? Cortisol, stress, response. And then as the needle stays there, the body realizes, well, there's actually no clear and present danger going on. We're actually going to be okay. And actually, at this point, we're going to do the opposite of the stress response, and we're going to secrete dopamine and norepinephrine and all of those nice neurotransmitters that are going to relax you and tell your body that everything is safe. And there's no reason to run from the bear and be stressed out anymore because we're good. And so that is, in essence, exactly how acupuncture works with so many disorders. Stressful digestive disorders, right? Anybody have a stomach? As soon as you get stressed out, your stomach hurts. That's a stress response that acupuncture will help undo, because you're going to remind your brain how to tell your body that everything is okay. Right? We're all walking around, like even this morning there's another shooting, and yesterday, and our president's maybe going to be impeached, and nothing is safe, right? School next week, when we go home, God knows, right? There's constant stressors where we're kind of abusing our fight or flight mechanism to just survive, right? And that drains us, and all we know now is like, okay, what's coming next? And when I have people come in, and they lay down, and we get this treatment, and the brain actually tells the body, you know what, you're actually safe, we're good. You get a new pathway created in the brain that can be repeated again and again once you're out there. And then you come in for another treatment, and it goes a little bit deeper, and we redo it. It's like riding a bike. And then I get another, okay, wow, we're going to light up that calm pathway again. And then you go out there, and you're like, you're not freaking out at your husband anymore. You're not yelling at your kids. You're not stressing about the test because you have a way to access, like, I'm calm. I actually feel pretty, like, I'm good. I can recover quicker. So these are the things I see happening, and I've got 20 years behind me to prove, like, wow, these people's lives are improved because their brains are getting reset when they come in, do the treatment, unwind the nervous system, calm down, shut up, right? Take some deep breaths and reset you. And it actually is something that can change how your brain works out in the world, right? So in that, it's brilliant. So I love what I do, and that these two different things that the acupuncture can provide, both physically, like I explained, and then in the brain with the nervous system, which in essence, that second one, I'm walking around now, not so stressed out. I can recover quicker. I notice when my body's freaking out and I can take a deep breath. Or, God, when I was in with my treatment, she put this peppermint oil on and I remember that. So now it's like Pavlov dog. When I breathe, when I smell peppermint, it's like I'm in the acupuncture room and my brain goes exactly where I was in there and I'm good, right? And then eventually I won't need the peppermint oil because I can do this all by myself. So it's just like that. And we just retrain. And you guys are all capable to bring yourselves down out of crazy and shorten your response times. And whether it's with your health, your people around you, your school, your pressure on yourself, whatever it is, so beneficial. So, right, you can see how cool this kind of thing is. So, I love what I do because this is what it offers. All right? So, any questions so far on how it works? Can all of you repeat that?
Reset the brain.
Right? 2 ways to do it. I kind of explained physically what we're doing with the needles. This isn't some magical voodoo medicine where it's just yeah, there are meridians, there are channels. It's very real, and there is an in-depth amount of study you have to do. So I forgot to call Carissa this morning to find out what the new, so I'm just going to cover this part. So acupuncture as a career, you have to have a bachelor's degree, right? You have to have all that settled. Then you have to have science classes, some health classes, right? Some as far as medical. And then it's a 4-year program. And it includes an internship, and when you get out after 4 years, you take a state license test that's for California specifically if you're going to stay here, and you study both acupuncture, Chinese medicine, the language which you get to learn. You study Western medicine, so you know what you're putting your needles into. You go to cadaver labs, you do all that, and then you also study Chinese herbs, which is a big part of nutrition, and that part, which is just as effective, and it's a whole nother lecture, to be honest with you. But everyone you go see in California, if you go to an acupuncturist, is also an herbalist. In other states, it's not the case. So it's kind of cool being here in this state because it is honestly the hardest test in the United States to pass. And you have that herbal requirement, which is double your expectation and double your volume of amount of information you need. So going here to someone here, obviously make sure they're licensed. They wouldn't be practicing if they weren't, I would hope. And then you also have an herbalist as well, which is really important. It just accentuates what we do. So that's kind of that. And I love what I do. And there's a lot more people doing it. And then the other thing, too, is it's very integrative. I work very closely with some reproductive endocrinologists in Westlake. If you guys didn't know, it's like a huge hub for making babies right there. People fly in from China. Like, these guys are packed, and they make so much money, but they refer me when they see a problem or they need a little more time with their patient. Maybe their lining isn't thick enough to hold the baby, things like they're too stressed out, their hormones are whacked out. They do refer to me and some other practitioners locally to help with that so their results are better, because what they really want is their numbers to be high, and it's a cool, honorable place to be able to work with these guys because they're brilliant. I also work with orthopedics. There's a whole group of orthopedic guys, the Spanish Hills guys, and they send me people when they're like, I don't know what to do, or we don't want to do surgery yet, let's try this first. I do work comp patients with pain management, all kinds of stuff. I have someone with digestive disorders. We have all, yeah, it treats a variety of things, but underneath it all, anytime you get acupuncture, it's going to hit you at that stress management level as well. And some people just come in just for stress. They want to experience it. So what I want to say right now before I forget is anyone who's here right now, if you guys are interested in either talking to me further about your own stuff or want to just come in and experience it, you just call us. I have a secretary, Lauren, who will just tell her you were here and you guys get a student discount or however. And I would love to take care of you or talk further about if you're interested. Okay? So,
What's the number?
say again?
What's the work? How can we find you?
Oh, show them the website. Yeah,
Yeah. Let me
there's
go.
the website there.
Oh boy. Visit us. Is that good there?
Yeah.
So you guys take a picture of that maybe, or? And then I have another document. If you guys, it's so much easier to. I hate to say this, but it is to take a picture of it if you can, of some recommendations of foods and things like that with organ systems, and that'll be a little bit later. But you guys all got that? I didn't need to bring cards. Didn't bring any cards. I'm a total businesswoman. Sorry. Didn't even think about that. That's okay. You can find me. All right. So any questions? You guys good? Yes.
You said you primarily do food on the back. Can you like what if you have chronic pain like in your hands or your feet?
Oh yeah, no, absolutely, and all, the back just today because it's easy, and yeah, no, we treat front, back, head, everywhere, all over, yeah, wrists, knees, elbows, all over, belly. I treat for menstrual stuff or digestive disorders, yeah, everywhere, wherever something's going on, we put it, not everywhere, but put a needle. Put a needle in. Not everywhere. All right, so good question though, yeah. But for today, it's easy to just do the back because it's a nice, easy presentation. And
I'm going to put your website up on the
okay, good.
canvas.
Thank
thing
you.
for everybody, so.
Okay, so now we're going to go into just a little theory, which is I like this part because it's interesting. Now, timing-wise, I think I'm going to get my patient up here, and I'm going to do a little demo, and then I'm going to talk. And I'm going to watch him while I'm talking, and then I'm going to pull his needles, and then I'm going to cup while I'm still talking, and that should take us to about 20 after-ish, okay? And that should work. So, are you ready, sir?
All right, yeah.
So he gets to get this free treatment because he hauled this chair in for me.
My back is.
So, we didn't have this chat, though. Do we have issues?
I actually,
Whatever.
Bottom right shoulder blade
Okay.
is a knot, makes it hard to
Okay.
lift up, and
Okay.
lower back pain, sometimes the right sciatica.
Okay, and have you had breakfast or lunch recently? Have you had any food today? That's not good. But are your blood pressure's normal?
Yeah.
Okay. Why haven't you eaten? It's like 11 o'clock.
Coffee comes.
Okay. So you've signed that. So if you pass out on me, we're good.
Yeah.
Okay? Always
I'll be
eat
okay.
breakfast.
I'll be okay, right?
I'm kidding. That was kidding. But, all right. I should have thought to bring something to eat. But okay, so what we're going to do is I'm going to have you do have to pop your shirt off because I got to get you back. And then you're going to come on here and then you're going to kind of go like this. And then I'm going to
go like that.
just like this. Okay? So wherever you want to be, it would be best if you could put your hands maybe just on your knees.
Got it.
I just figured out what that other piece was for, is for your hands. Yeah. All right. Thank you for volunteering and
Right
being
shore.
vulnerable in front of everyone.
Always like to get poked
I
in the
appreciate it. So, is that comfortable?
That is
I
fine.
don't know how to adjust this quite at the moment if it wasn't. So are you okay? Okay, perfect. Okay, so alcohol. So this is the experience, but in the treatment room, you're usually on a bed, and you have a heated little cushion underneath you, and you're all warm. Did you say left side or right side?
Right side.
Okay. So hip
I feel
sciatic.
cheated though. I'm not on a bed.
Well, and I didn't bring my more serious needles because I wanted to make sure you guys saw how sweet and gentle I am with needling, how painless it is.
It's true.
Right, Kevin?
It's very true.
Is it okay to be nervous?
Be what?
Nervous?
Yes.
Okay, good.
Are you okay?
Yeah, we're there.
Oh, you're fine. So, huge question. Are these sanitary and do you use them over and over again? Which is ridiculous. No, of course not. I just opened this. There's 10 in here, along with a guide tube. I use this once, and then I put them in a Stericycle that I did not bring, and I put them away, but it'll be transferred when I get to the office. And they go in a Stericycle, and then they go to the waste management system. So super safe, okay? We never reuse needles. It's not even with same patients. It doesn't happen, okay? So, did you hear that, sir?
I heard that.
Okay. And these are, does anyone know gauges, like big, little, right? So 36 gauge. So the bigger the number, the smaller the needle width. So when you go get your blood drawn, it's like 26, 24, 26, depending. These are 36, so they're less than half. Super hair fine, thin. They bend, they're tiny, okay? Just so you guys know. There are bigger ones. I should have brought them because they're fun to look at, but
Smaller, less
we're
pain.
trying. Our goal is to get you guys to be open to doing this, so I don't want to bring things to.
Oh, I changed my mind. I'm just kidding. I'm ready.
Okay, so you get to see some structural work, which is not everybody does this type of work. I have to acknowledge Matt Callison, who's my teacher in San Diego. So this kind of thing in here. So you all know this one, like the rump between the shoulder blades. This feels amazing. So what we're going to do right now is get this muscle to kind of contract and release. Okay? So you ready? So breathe and exhale. So you should feel a little achy. Do you feel it? Barely though, right?
Barely, yeah.
You good?
You put a needle in me?
See?
No, really, just kidding,
I
right?
paid him to say that.
No way. I don't-
Right? So I'm kind of going off my beautiful symmetrical thing because I want to get to his shoulder blade and treat his symptoms,
I
right?
think you're full.
You okay?
Yeah,
So now I'm going to
fine.
go above because I know all the muscles that kind of relate with this one. They all kind of go together.
Okay.
You okay?
Yeah, I felt that one, but it
So
doesn't hurt.
but I want him to feel it because he's got a shoulder that's got a knot in it. So I want to get in there. Remember what I'm doing is I'm breaking it up. I'm kind of irritating it so the body goes in and heals it. Now you see the little red mark around it? I don't know if you guys can see that, but there's a little tiny red, which is your histamine response, which is healthy. Okay? Yeah. So is that on me right now, Kevin?
Yeah.
That guy? You're on camera, by the way.
Oh, no.
They won't see your face.
I'm a star now.
Right? So, and I'm doing this a little bit so I can feel the muscle grab the needle. It's very gentle, but it's, right? And then we've got a response. Now, I can do this to where you wouldn't even feel anything. If I wanted to, right? If I wanted to just, and I'll do a couple of those. So now we're going to go down, and I'm just going to do what we call these shoe points. Just little tiny taps. And that's it. They go in, right? Barely.
Can't feel it.
No, are there needles sticking out of
There's
my back?
4 of them in your back.
No way.
Yeah.
You're going to get
You know what's weird? You don't feel it when she does it, and then after a little bit later, I can tell there's something there, but it doesn't hurt.
Yeah, so breathe right now into your belly. We have soft music, and we want to play some music. And he gets to relax. And these are going to stay in probably maybe 12 minutes-ish. Okay? And every once in a while, you come and you do this.
The one I can feel is the top left one.
Yeah, that's your shoulder problem.
Yeah, I feel those. The other ones I don't feel.
And then you get some cupping. You can do it all.
That's weird. It just feels like you're pushing me with your finger.
Mm-hmm.
It literally doesn't hurt. I don't feel any.
You guys hear this?
I think I would jerk or jolt if it
So I'm
hurt.
counting spinal cord segment. Down, down, and I'm going. Now we're going to just do. I don't have needles for your hip today, so we're just going to
That's
look out
okay.
here.
That's amazing. I thought I would feel it or jump or something.
Well, I could make you do that.
No, that's we're good. If I got needles sticking out of my back, I'm good.
And I have a heat lamp, so you're going to be on nice and warm in a second, okay? Because that's important.
I got needles and I'm laughing. That's great.
See? Anything is possible. Okay. So what can I plug this guy in? I forgot about this. Because he's probably cold. He's kind of exposed here. Are you okay?
I'm
Actually,
fine.
in the floor right there.
I'm good.
Oh, right here? Whoa.
Do you want me to take a
Oh, that's
picture of
scary.
you?
That was.
Yes.
Okay. So I'm going to go.
Yes. Someone take Melissa and then you can send it to me. I gotta show my wife this.
She's going to be like, what did you do today?
Yes.
What did I teach you? There we go.
Oh,
So
hey,
now we
that's-
have, this is
that's
another
good.
thing that is important to know. So it's a different type of light, right? So this is an infrared, which is really good for muscle tissue spasms and pains. So there's a point to the actual lamp, right? It's not just for warmth. Except it's a little far, but that's okay. You feel it, right? Well,
Yes,
you
it
did.
feels good.
Yeah.
Yeah, as soon as you hit the heat lamp, it was like, oh, that's nice.
There we go. Okay.
Very, very nice.
So now he relaxes, and we let him be
I relax.
for a few minutes. Okay? All right. Any questions on that? Right? Yeah.
Why were you flicking the?
So this is just sort of re-stimulating the point, right? We also have a e-stim machine that I didn't bring, but
You touched the needle?
one thing at a time, right? But we have an e-stim machine where we hook little clips to the needles, and they're in the muscle tissue, and then you turn it on almost like a TENS unit with the chiropractor, and it goes doop, doop, and the muscles contract, release, right? And what they call it in the traditional Chinese medical translations is it does the work of 1,000 Chinamen, because it means I can leave the room and it'll keep twitching the needle, so I don't have to stand here and do this. Because I want to disperse it.
You're flicking the needle?
You feel it?
Wow.
Right, see, he's all.
I mean, I can tell you touch something, but
Yeah.
no.
But
It
there's no
doesn't hurt.
pain. It's not
There's no
like
pain.
we're jamming acupuncture needles in,
There's
right? It's
no
super
pain.
comfortable. Yeah.
You know, my question is that his first issue was he said his lower
Yeah.
left
Uh-huh.
or lower right side, and then his upper left.
Yes.
Him telling you that is his pain. Do you attack like the area where it's actually painful, or do you work with like the other side of like the paired nerves and work on like
Totally. Yeah, no, that's a great question. So you should, yeah, no, I like how you're thinking. So did you guys all hear that? She's just wondering what I'm doing to think once he tells me his symptoms. So we could have done a role play like he's my patient, and I could have gone into the, that would have been good maybe for next time, like what to expect. Because he'll come in, and before I even do this, I talk about his digestion and his sleep patterns and his exercise, especially with physical pain, exercise, sleep, and nutrition. It's huge. What are you doing? Are you doing anything to help your shoulder except sitting and studying and driving and not sedentary or not, right? And so once I get the locations, there is a pattern here, as you said. Right side in the lower and upper right. You accommodate. We do all the time. So with him, I would actually, if this was if I was at the clinic, I'd have bigger needles and I would put it more into his hip that some of us here have experienced. And you get to fire and release in the muscles that are surrounding the sciatic nerve. And then I release those. And we also work on the front of the hip because that's part of your back pain all the time. And your shoulders. Like if all of you have any of you have neck pain, if you dig into the front of your shoulders and right here, it's not good, right? There's a problem because we're all like this, right? All the time. The anterior front of your shoulder and the front of your neck is responsible for these shoulders, right, or the back, right? So it's kind of like, right, it's like now everybody's sitting up straight, right? But yes, so you have to do the diagnostics and go, okay, now what?
Like, how do I assess? Okay.
Exactly, right? Right, and what are we going to do about it? So I'm not going to just put needles in, take them out, throw a cup on, and send him home and go, good luck. Because he's got some work to do at home with strengthening, doing some definite postural assessment, like how am I even sitting all the time? What am I doing to the shoulder if I'm repeating stuff? Strengthen it. I have a group of people that do like Pilates or physical therapy, foundation stuff, that address all that. It's a village, right, of people that help. But I won't let people come see me unless they're going to do everything I say, which is not just this. So very good question. Yes. Yes.
To kind of piggyback a little bit that my acupuncturist has like a reader.
Yeah.
Like she tells me if there's like higher percentages of like tension or something in my spine side, like sciatica.
Oh, okay. Yeah. Is it like she rolls it down and it'll?
No, it's like she almost attaches it to my spine, and she's got like these things that she clicks on each like vertebrae. Clicks on each vertebrae, and it gives like a reading.
Oh, cool. Is she chiropractor too?
Getting
Carol
warm.
Ventura, do you know her?
Her name's Karen.
Karen Carroll.
No, it sounds very cool though. Okay, and so she can kind of energetically read. It's yeah. I love it.
And then she like puts the needles in the
And then
spine.
she goes, "Yeah, that's great. Yeah, I mean, you can. I mean, even like if you actually sit, if someone has pain in their spine, if you palpate pretty heavy down along the sides of the vertebrae, it'll feel like a bruise where something's off. The rest won't, and then you know where to go. But I love that she's got a little device. That's great. Yes,
Getting a little warm, you can kill the heat.
got it.
Okay.
Better.
Yeah, much better.
Glad I'm here. Yeah.
What's comfortable? Starting to sweat. Don't worry.
When you do these sessions, is it like just to kind of get a better understanding? It's not like a life altering thing after one session. You have to go like multiple times.
Right. Good question. So it depends on what you're in for, right? Completely. So if someone is in, a lot of people like could understand. Like I'm going to go in for acupuncture because I'm having pain. So I'm having shoulder pain. So I have two examples, right? And I have one is a guy, one is a man, one's a woman. Different situations. So man with chronic shoulder pain, and he's in his 50s, and he plays pickleball or whatever he does. He's super fit, but he's got problems, right? Overuse. He's left-handed. So I did probably 4 or 5 treatments, and his pain went from all the time at a 7, 8, with 10's the worst, down to a 1 or 2, and managed. And he's like, wow, that was good. And he changed his form, and he's doing things differently outside, and give him some minerals to take at night. he's good and he's happy and he refers people and that's him. Now I have another woman who came in with neck and shoulder pain, numbness, tingling, like we're talking paralysis, like, you know, potential surgery candidate with her neck. She's in her 50s. She's been caring for her son since he was born. He's got multiple issues, wheelchair, all kinds, like full care, like hardcore. He's 40 now, okay? So she's in her 60s. This is her life. She comes in, I've got pain, I sit her up, we'll be doing cupping. I did a cupping session while she was sitting up, completely emotionally lost. Her life flashed before her. She just had a really very profound experience, kind of released all kinds of energy, like stuff. And she walked out of there like she had about 80 pounds off of her emotionally. She was like, I don't know what just happened. I didn't know it was going to happen. And she just was able to release all kinds of stuff. And it was cupping. It wasn't even the acupuncture, but it was the cupping, which you'll see in a minute. So that was life-altering for her. I still see her when I can. Once in a while, she still comes into me like once a month just because she believes she needs to keep the energetic work going and keep clear. Does that make sense? So there's everything in between that too. You know what I mean? And you know, at this point in my career and what I'm doing, you can come in and we don't have to, because obviously you're here for a reason, but we almost always go into, okay, what's going on? Why are you so stressed out? What's the problem? What is really getting you? Why are you stuck? And usually stuff comes out, and not every acupuncturist does this, but at this point in my world, if you don't resolve the stuff that is stressing you out when you wake up in the morning every day and go, God, I got to deal with that, and you're not getting it yet, the acupuncture is really successful at that because of what I talked to you about. That calming, everything is okay. Take a deep breath, reapproach it differently kind of stuff. Because that is, it's super important. Yeah, I'm taking that.
Oh.
Yeah, you're worrying me over here. You're getting all agitated. Is he
I am?
agitated, you think?
No.
No?
No, I was going to ask
You
a
okay?
question.
Yes, please.
No, I'm perfectly fine.
Okay.
If you got to leave them in, leave them in.
Yeah.
Does acupuncture help with like migraines and headaches or chronic migraines?
Sure. Now,
Does it?
that's a great question, because then I can talk about how we look at things. We do our differential diagnosis, right? Which means in Western medicine, you go to your doctor and you say, I have a migraine. And they're like, okay. And they're going to give you what? Migraine meds, right?
Yeah.
Which help, right? Imitrex, you got to get it early, but if you do it, then you're good, right? Not good on your liver, and it doesn't do anything for the cause of the migraines, right? And they're going to look in, a good doctor's going to look in. Now I'm going to put some cold lotion on you. Are you ready?
Uh-huh.
Okay. They're going to look into why the migraines are happening. Are they cluster? Are they, what kind are they, right? And figure that out, but still, same medication, right? Doesn't make a difference. So with Chinese medicine, you come in and you've got some issues going on with migraines, and then we're going to talk about your sleep and your hormone cycle, if it's a hormone thing. We're going to talk about your bowel movements. We're going to talk about your lungs, your immune system, like every system, and we're going to kind of figure out what kind of pattern you have. And that's when we kind of go into the chart I'm talking about. So I could have 3 people with a migraine headache, okay? One of them, they're going to have it back here in the back of their head, and that's from tension, from structural issues. The other one is here, because she's got really whacked out hormones, and we got to correct the hormones, which is a totally different approach, right, than a tension neck treatment. And then the other one is on the top of their head, and they have high blood pressure and a whole lot of stress. And that's their cause of the migraine, right? And so I'm going to treat that guy differently than the neck guy and the hormone girl. Completely differently, give them completely different things to treat it, and have pretty good success. Now, that's how we work with migraines. And I have quite a few people that come in. Now, not everyone gets cured by acupuncture and Chinese medicine, okay? It has to do with your diagnoses and you being able to get the right, know what you're doing. But it is very successful in many, many cases. So, okay, cupping is happening now. You ready? You ready?
Ready?
Okay. So these are the cups. These are the fire cups. Have anybody got a massage with cupping? A lot of massage therapists are doing cupping now, which is great, but just before they do it, just ask them where they learned it. Like make sure they know what they're doing. A lot of physical therapists are doing cupping now. Okay, so this is the traditional fire cupping. You don't see this often, but I love it because it's glass fire. It's how it was done originally.
You
Okay?
put me on fire now?
Yes.
Awesome.
Here's how it feels without the suction. And now I'm going to go. So there it is, right? So on this side, because he has pain in here, I'm going to do a little sliding because it feels really good. Okay, and what it's doing is it's using suction to pull
Oh, what a trip.
fresh blood in the area and all the old lactic acid. I'm not going to
That does feel
slide
good.
it because it's pretty tight and he's never done this.
Yeah, that was pretty awesome.
Okay, so we're going to get to below. This feels amazing. It's like hickey, right?
Does it keep
So-
sucking? 'Cause I
So
can feel like
he's
getting
going to
stronger.
have big red marks
Yep.
on you. Tell your wife.
You're my witness. Nothing weird was going
I
on.
did it.
I'm innocent.
All from me.
Melissa, you're my witness.
I videotaped
This
it.
crazy
Oh,
chick.
God.
Yeah, it looks less like a hickey and more like a giant octopus attacking you.
All right.
And Kevin gets like.
Oh, I get it, yeah.
He loves,
I
I
need
love
what
it.
you
So
Where I've
it
been.
I'm so jealous. It feels so good, right?
Yeah, it does. I like this one.
So I'm
Well,
losing.
the
I'm losing
acupuncture I
punch
couldn't
here,
feel. It didn't hurt, but I didn't feel anything. This I feel,
but it feels.
and it feels kind of cool.
So now I'm losing my flame, so I have to reload.
Now, is
So
there fire?
Yes.
what's
Is there really?
Yes.
Oh my God.
You can see
I
the
don't get to
video
see-
later.
I videotaped it.
Awesome.
So what's happening in the cup right now is the pores are wide open, right? We have suction pulling and the pores are open and out of the pores, through the pores, out of the body is CO2. It's like emitting gas. Now, if I had water and I somehow could put water in here and put it on there, it would be bubbling.
Wait,
Okay,
that's
it's
like a
really
gremlin?
cool. And we do wet cupping, which is even more exciting, which means I'll take a lancet and I'll put it right where he's hurting. I don't want to lose you guys because we don't do this all the time. And we put it right, and I do a couple little pokes deeper, and I put the cup on, and then blood comes out, and the blood fills the cup, and it bubbles. It's really cool. And it relieves the pain. Like, imagine if he's had this for 20 years. There's stuff in here that has to come out.
Yeah.
Like, think of old school medicine. They used to bloodlet. They used to do all kinds of, and it worked, right? And it was effective, but kind of archaic. But now we bring it into the 20th century, and we can do it like this, right? So basically, Chinese medicine is bringing like old school things, old school theories into today and making it actually really work well. So this feels really good on this
Yeah.
SI joint. It's going to be kind of tight and funky. You okay?
Yeah, no, I like that.
So I'm pretty heavy cupper, which means that like strong, but it doesn't have to be strong. It can be super light. So you
That
see
one
what's
feels
happening,
good
right? And if you look on the side, the skin's up. So there's a really good story in the classics about this. Now I love Chinese medicine because you learn a lot about it through these stories, right? And all these symbolism. And so there's a river in northern China, and it's known for its magical qualities of healing people, right? So magical water. So everyone in China would go up to this river in the north, and they would, especially if you were in like terminal or really sick, and people would take their loved ones and they would submerge them in the water of this river, and they would be magically cured. And so this is like a translated story. And what was actually going on is people would get out and they were covered in leeches. And the leeches were pulling the disease out of the body through the blood. They were basically bloodletting, getting rid of the blood that has the disease, and your body's forced to create new blood that does not have it, and it will eventually win, right? And so that was going on, and so they're kind of like, how does that work? How do we replicate pulling blood out of the body in order to improve health? And this was the solution, is the translation. It's kind of cool. One of the many reasons why cupping came about. But kind of cool. So these stay on about 10 minutes. The first minute is the most intense, like the most happening, like, whoa, that's right, but they're calmer now,
Yeah.
right? Then
Yeah.
you want to feel, most people are asleep by the 10th
Yeah,
minute.
lost this one. I don't really feel it.
Yeah, and I can move them around, but I won't. But yeah, and then this comes off in 10 minutes, and then we put some nice little ointment on, and he gets up, and he goes about his day, and he's all relaxed, and he's had his nervous system worked on, he's had his muscles released, and he's had the toxins pulled out of him, okay? Yes?
I'm a new man.
Do you need this for like sleep issues?
Uh-oh, one
Yes.
Awesome.
Yes. Sleep is a really interesting thing.
I imagine he's gonna get really good sleep.
Yes, and you will sleep real good after your first treatment if you've never had one. And people do come in for insomnia. They're, again, not like Western medicine. Insomnia has so many reasons why it's happening. First thing you do is put melatonin in 3 milligrams and you see if that works, right? And if it doesn't, there's other reasons, right? And then there's all kinds of insomnia, right? There's a fall asleep insomnia, the I can't fall asleep. Then there's the maintenance issue, which I fall asleep fine, but I can't stay asleep. I'm interrupted all night. We treat those two very differently, right? But the acupuncture, we do the points for the head, like we were talking about, that de-stress, that, right? And it is so effective. And underlying insomnia, sometimes it's just it's a pattern in the chemistry in the brain, and we can help override that with what I explained earlier, right? So I love working with that. Now, there has been 1 or 2 in the 20 years where I've had people who were severe insomnia, and we refer and try to figure it out, and it's tough. But between the herbs, which are really effective, and the acupuncture itself, it's fantastic. I have a lot of business people, corporate people that come in just to get that keeps them going. They're just like, I don't know what I do about it. So it's really very cool in that way. Yeah. Any other questions? Yeah.
This is a weird question. What about like sleep paralysis?
Sleep paralysis, as far as just,
I don't know, because it's just sleep.
Yeah.
When you're asleep, so I
Right.
don't know if you've ever
no, that's a good question.
been.
Yeah, no, to be honest with you, I've never actually had that so yeah, I mean, I can look into it, right? And you got to also look at everything else that's going on and be like, okay, what's happening there, right? And that's the key to this medicine, why it works so well. It's like it looks at the whole system. So, any other questions so far? Yes?
We talked about the physical aspects, but I'm actually really interested in the energetic aspects. So what it is you achieve.
Right.
And applying using blockages.
Mhm.
I know that a lot of the blockages are actually, or I guess have manifested physically due to energetic
Yes.
practices.
Yes. Yes.
So what is happening when you use acupuncture and
As far as energy, right? Good question. And that's what that slide is for. So, you doing okay?
Oh, yeah.
Nice transition. Thank you. So then we go into an energetic blockages. You can refer to that as, a huge way to put it is the emotions and stress, right? And how it affects each organ system. So an energetic blockage, how would you define that, right? It's a place where your body is stuck. Energy is stuck. You can have it in your lower pelvis, you can have it in all different areas, and each area is there's a different reason why, and we each have our different, and it starts so early. We develop these patterns when we're little kids, we just do our thing, and everybody's so different. You and your brother do it totally differently and you got trained and you got raised in the same house. It's remarkable how different we are an individual. Knowing your own patterns and what you do, whether it's in your gut, right? That's an energetic blockage, right? Or if it's in your nervous system, it's in your head, you get dizzy. If it's in your muscular system, whatever. So, okay, so I like this chart because if you guys want to take a picture of it, you can. Then you can remember it. But this actually talks about the 5 elements, which you guys have been exposed to, and what stress does to start breaking them down. Okay? And I love this. So we're going to start, I like it. It starts with number 1 is stress. And then we go first into the liver gallbladder. Okay? Now the liver and gallbladder are one of the most energetic organs because it has so many jobs in the body. Now, the liver produces cholesterol, bile production becomes imbalanced. Okay, so this talks about what's happening when it's wrong. So, liver and gallbladder are directly tied with negative emotions of anger and irritability, frustration, jealousy, envy, all those right? You all might know, everyone has a certain organ system that is predominant, that is off. Right? You know those people who are quick to anger, temper, those kind of people, those are liver gallbladder people, okay? Anger, jealousy, and envy, if you have enough of those emotions for too long of a time, it actually will start to affect your liver meridians. You can palpate the meridians and where they are and feel. You can actually feel pain, where the liver is in this quadrant, hypochondriac pain, which means in the rib cage. Your eyes, people have red eyes or irritated eyes. That's another symptom of the liver. And the more anger, jealousy, envy. Now, the cure is to not repress your emotions, and that will help cure your liver issues, right? So there's always a cure to the pattern of imbalance, okay? So that is what goes on with the liver. Now, we go up here to the heart and small intestine. Now that is the main emotion of the heart is manic. It's like joy. It's kind of hard to describe. If you ever see people are manic, one of the main symptoms of someone with a heart issue emotionally is they kind of laugh inappropriately, kind of nervous, you know, this kind of people. Interesting. But the heart, it also comes with heat and insomnia. A lot of times when someone has a heart imbalance, so we talk about palpitations, high blood pressure, and chest pain. So when they come in with those type of imbalances, those symptoms, we look to the heart organ, and then we like to have those conversations about what's going on with, maybe there is a little mania. Maybe there's a little imbalance chemically that you might be a little bit too up, right? Or not able to bring yourself down, or like that. And the negative emotions, hate, cruelty, and impatience says are the things that that really start to break down the heart meridian and the heart energetics itself. And then you go into, where are we going now? The spleen and stomach. Now in Chinese medicine, that's your digestive system. All of you guys, your spleen and stomach, your digestive system are taxed because you're overthinking and studying a lot. Now, have you ever noticed when you're overthinking and in exams and stuff, your digestive system can sometimes become impaired? That is a direct relation. And overthinking and worry is another thing that will start to break down your digestive system. And the end result of that is people who cannot have slow metabolisms, kind of heavier, they have phlegm and dampness and just feel ugh all the time. They're not able to keep on their optimal weight, stuff like that. They hold. But the worry and overthinking is one of the main issues with the spleen, stomach, and the pancreas. And so we see energetic blocks in the digestive system. And so we treat that. We choose points that are on the spleen and stomach meridian to open that up, right? You have a question? Someone here? Did you have? No. Okay. So that's the spleen and stomach. And then we go into the lungs and large intestine. This is a really interesting one because it's specifically accurate. This is the emotion of grief. So the lungs and grief are specifically tied together. A lot of times when someone loses a family member, there's a death in the family, people get sick. It's a respiratory issues happen pretty commonly when you have grief. You stop breathing, right? If you lose a relationship, you don't breathe anymore. Things start, any type of grief, it does affect the lungs directly, and lungs are tied with large intestine, so sometimes you can have digestive disorders. It gets a little complicated, but decreased oxygen in the blood, you have asthma, you have allergies, that kind of thing is the example of a weaker lung system. So if you kind of look at this chart as I'm going around and think, what are my main issues? Do I have allergies? Do I have skin conditions? That's your lung. Do I have digestive problems? That's the spleen, stomach. Is my heart? Do I have high blood pressure, palpitations, insomnia? That's your heart, right? Liver is more of that like irritability and anger and frustration and not able to shut that off. That's your liver. And then the kidneys are, oh, where'd you go? There we go. And the kidneys is the last one, and that has to do with your willpower. And again, it's kind of the subject of today, which is the stress response. That's your adrenal glands, the fight or flight, right? A lot of us get our adrenal glands kind of drained because we're constantly going. The kidneys' emotion is fear. So anyone, like I did when I had my accident and went in for my first treatment, that guy treated my kidneys. That was it, because I was in a crazy head-on bike collision, and there was that fight or flight thing going on, and I was in a PTSD situation. So fear is a huge thing, and if you treat the kidneys, you can actually start to try to unwind that sort of, anyone who's been through a traumatic event, we always look at the kidneys and treat it, okay? So, and then with that, kidneys is kind of easy too. We have reproductive problems and bladder problems and things like that, okay, that come with that. So what's kind of cool is you can think about yourself and go, okay, which category am I in? Or maybe one or two. And then what am I going to do about it, right? So when you come into a Chinese practitioner, we look at that and we assess which organ systems are off. And that's when we do the different type of energetic treatment, which goes on, not like this, because this was just structural, okay? So on the front side, and even on the back, you've got all the points that go with the corresponding channel that hit the organs. Does that make sense? I'm sorry, say that one more time.
So going to school, do you learn to physically see the meridians, or are you working with the physical body to interact with
Both. Yeah, they teach you, I mean, you got charts upon charts of where exactly and point locations and all that.
them? Study, you learned to know where they're at?
Yes.
Or can you also have you adjusted to be able to see?
Right, both. So once you're out of the classroom, just like you guys, tomorrow, today, you actually start to learn the practical, and I have 20 years of experience knowing like, wow, okay, you know, and you just know what to, yes, that becomes in time with experience and basically, and also my own work on myself and being able to be more intuitive and hone in and just really getting to know the medicine, to be honest with you. But yeah, you get both when you're studying, and then you take it wherever you want to go, right? So today you got an example of a very structural treatment. But on the back here, this is the point for the lungs. This is the point for the heart. Just below it is the point here for the liver. We have the digestive system here, and we have the kidneys here, all represented on the back, which I kind of did on him. So I can do a systemic treatment to balance his whole nervous system and every major organ on the back. It's called the back shoes, right? And it's beautiful. So he got a little bit of that today. And a lot of times, like let's say I have a patient I know that's coming in today that is so stressed out. I'm going to lay her down, warm her up, and do those 5 points on each side and let her cook for about 20 minutes and just have her completely knock out. And it resets the nervous system. So like here, T3 innervates the lungs. It's proven. The nerve that comes out of T3 innervates the lungs. So when I needle that nerve, we're going to innervate your lungs and get some response. Does that make sense?
Yeah.
So it's great. I mean, that's a lot more than you guys need to know, but it's really pretty cool what goes on as far as internally. But that's a big question.
And Julie, you
Yeah.
mentioned this in the slide. This corresponds to the elements, the five
The five
elements,
elements,
right? So liver is wood, liver and gallbladder is wood, heart and small intestine is fire, spleen, pancreas is earth, lungs and large intestine is metal, and kidney and bladder is water. Right. So this is remember that creation cycle that we talked about. This, and then there's also, which you're not going to go into in detail, there's a destruction cycle, and then there's a controlling cycle.
Yes.
There's 3, right? So that's the, but this is just the creation cycle.
Right.
So it's the
This
same
is the
as
first one. You guys learned all 3?
They theoretically, yes.
Very good.
No, they just learned this one in the destruction
Okay.
cycle. We didn't do the controlling cycle.
Yeah, and I'm
Those
sorry, I kind of blew through that trying to do a few other things. So, but yes, so all the organ systems and the elements. Thank you for your participation. A lot of water today.
A lot of
We'll
water?
get something to eat.
Okay.
Yeah.
I will. Hope I don't fall asleep driving home.
Yeah, drive carefully. Just
Be
don't,
careful. Did you sign both sides? Yeah.
I did. I'm good.
And I'm so, there's
amazing.
so much information, and I'm trying to figure out which to share and how much, and still do demo. You guys get it, but keep you here with me because it's the last day. And anyway, so yes. Any other questions?
No, it was that there's so much information on there.
So much.
Because
Yeah.
there's the yin and yang looking
Yeah.
at each of the organs.
Yeah. Yeah. Oh, and I touched you guys. There's so much. So thank you for being patient with it. Now I have one more thing for you. Maybe take a picture of it because I took my time to do it, and I want you to have this information. But it's actually stuff you could do. So take a picture of this one, and then take a picture of the next page.
Julie, if you want to send me the slides, I can post.
Oh,
them.
I'll send it. I'll just send it to them.
That'd be great.
Because this is now talking about, grief and depression. Do you guys remember what organ that is? It's the lungs, right? Which is metal. And I'm going to talk to you about what's going on, what foods to reduce, and what foods to start eating more of to help balance that organ. Okay? So you get some practical stuff here. So I'll send it to Dr. Volkin, and he'll send it to you guys. Okay? Do you guys have any other questions? Yes.
Is there any research that backs any of these things?
No, I'm just kidding. That's a great question. So research of all of this type of information, it's being done, right? The NIH has a lot of good studies. Pain management is one of the biggest categories because it's for the most part repeatable, and right, it's to follow the Western study model. It's a very difficult model to follow because if you can imagine all the variables that went on right here, right? Like how do I exactly repeat how he is doing at the time he did it, and my variables, his variables, all the variables, and how do you measure them? And it's just a very difficult thing to do, but it is being done.
There's a ton of good
Yeah.
research now, and they're doing sham needle studies where
Yes.
they put the needles and not on the points
Right.
versus the needles and the points.
Yep.
There's actually a compendium that was done by
It's
a guy
happening.
I knew. When the needles became FDA approved,
Yeah.
they had to do a study of all the double-blind things to show that they were effective. And so this guy I know, who was at Yosan, he put together the compendium
Oh,
of
I
the
love it.
studies. And it's
Yeah.
published. You can
Yeah.
find it. It's,
Yeah, so there's a lot more information now out than there ever has been. Studies in fertility is huge with Chinese medicine. It's all coming. So it's a really good time to be in this medicine and to be cooperating with our Western guys. I get referrals from all kinds of doctors. GPs, gynecologists, women's health, just a nurse practitioner send me. So it's such a cool thing. So thank you guys.
Thank you.
Very much.